I'm 63 and I want to retire now, but I can't get on Medicare yet. What do I do about health insurance until I can get on Medicare?
So if you're 63, basically you're less than 2 years away from being able to roll onto Medicare. So your options are a few. You could try and self-insure. Certainly don't typically recommend that because you could leave yourself some pretty big exposure there. You can purchase.
So when you say self-insure, you just mean basically roll the dice and see if anything happens.
Right.
If it does, I have to pay for it. If not, whew, I made it through. But ooh, that is a risky game.
It's
to
a
play.
very risky game, yeah. And we would certainly not recommend that. I'm just
Okay.
telling you what your options are.
Yeah.
You could, when you leave your employer, if you get to 63 and a half, you may be eligible to roll onto what's called COBRA, where you get to keep your employer benefit. Now, just so you know, you're going to pay the whole freight here, plus an administrative fee. So you're going to find out all the money your employer has been spending on your behalf on that healthcare plan. And
Ballpark figure, isn't that about 20 grand these days?
yeah, somewhere around there. Yeah, I was going to say somewhere between $1,300 and $1,700 to $1,800 a month. Typically is what that's going to cost you. So yeah, a little over 20,000 probably.
Yeah.
But it would only it'd be short-lived, 18 months, so you can at least know what your cost. And you should also factor in what is the out-of-pocket exposure on top of that, so you know your max risk there, right?
Okay.
And you can make that decision. You could buy what's called a skinny plan. So you have to remember the mandate to purchase health insurance was repealed. Right, so you're no longer required to buy health insurance. So now they're eligible to sell you what's called skinny plans that don't necessarily cover everything as it once had to. And you can also buy what's called short-term health insurance. It's for 364 days or less. There are carriers out there that will sell it to you and basically renew it the next year, so you could buy that. It's a little bit more of catastrophic coverage, which used to be old-fashioned, what we call indemnity insurance, right? Indemnify you for an unforeseen risk. Or you could look at alternative ways to get coverage through how I have personally my health coverage through a religious sharing organization. So I am, as you mentioned earlier, in my late 50s, and my health, I don't use the health insurance that I provide for you guys. I give money, a couple $100 a month, to a Christian health sharing organization, and then I have a max out of pocket every year of about $12,000 if I were to need drastic health care, and it covers me just fine. So these are just a handful of the options. That is the M in the SMART plan. But you need to make sure you make a good decision before you walk away. And not only is it good to plan this and be prudent, what if your employer says you're walking away, right? We walk into recession and this person is told, hey, you're retiring this year whether you want to or not. You need to be proactive thinking about what you would do in that example.